I'm Debi Santini. Thank you, Dr. Sanfi. I work in residency affairs here at the school. As we've seen in the series of presentations that have been conducted over the last couple of years in these patient safety and quality improvement sessions, there are tons of opportunities to improve patient safety, quality communication, handoffs in all areas of the hospital. But I'm a huge believer that there are also countless opportunities to improve those very things in the clinic setting too, most often even before the patient gets into the clinic to see you. I'm speaking to you today as a patient, not as the person that has to hassle you all the time to get your duty hours done, but as a patient to make you a little more aware of what patients encounter regularly, what I call the front end of the healthcare system. I have 3 cases out of literally thousands that I want to tell you about today. And as I'm telling you about them, I want you to think about the things that your patients experience when they come to your clinic and whether any of these things could have happened to them. I'm not a professional speaker or a medical person at all, so please bear with me as I read my notes so I don't omit any important details. So our first case, on a sunny spring day, this man is working in his yard when he snags his hand on a tree branch and gets a tiny little cut. A few days later, it's apparent that it's infected, so he tries to get in with his doctor but is told there are no openings and they send him to an urgent care clinic, which is perfectly acceptable. So he goes there and he gets some antibiotics, but the infection doesn't clear up. So 2 more times over the next 6 weeks, his hand gets worse and worse, and he keeps calling his doctor, and they say, sorry, no openings, go back to urgent care. So he goes back to urgent care and then sees a different doctor, and they give him antibiotics again. And he continues to feel worse and worse until one Sunday in early summer, he collapses at home, unable to move from the waist down. So the ambulance takes him to the hospital where they determine that this infection is now system-wide and it's in his spine. So he spends several months in the hospital with infectious disease specialists and IV antibiotics, and then 8 weeks of inpatient rehabilitation right over here at Memorial, trying to get some mobility back. He was discharged from the hospital in early to mid-November, and is told to follow up with his doctor in clinic 2 weeks later. So him and his wife for the next 6 weeks call the doctor's office every couple of days and try to get an appointment, but they're told there are no openings and the nurse will have to call him back to work him in. So they get more and more frantic and call, and no one ever calls them back. Until mid-December, the nurse finally calls and lets them know that the pharmacy had called to get his prescriptions refilled, but the doctor was declining to do so because the patient had failed to follow up after discharge from the hospital as instructed. So the patient and his wife are frantic and very upset, and they explain that they've called at least a dozen times for an appointment and no one's ever bothered to call him back. They also tell the nurse that the extended 5-month time away from work for this recovery has hit their finances very hard, so they definitely need the appointment to take place before January 1st when all of their deductibles start over. But the nurse tells them that that can't be because the doctor's schedule is completely full. And so in mid-January, they finally get in to see the doctor for the follow-up that was supposed to happen 2 months before that. So I hope these are sort of rhetorical questions for you. Could anything like what this patient experienced happen with any of your clinics right now, in the past, in the future? This patient was very, very, very sick, but despite his horrible infection and all the opportunities for problems and medical errors in the hospital, he survived a 5-month stay, only to be lost in the system, which is what his doctor told him happened when he was finally able to get in to see him in the middle of January. He's fairly certain that had the hospital not called, or that the pharmacy had not called the doctor, he'd still be waiting for a call back and would not have seen his doctor yet at this point. The second case is a healthy female who developed trouble swallowing, was referred to a gastroenterologist and had an EGD done. After the procedure in the recovery room, the doctor tells the patient and her family that they didn't see anything too questionable, that they dilated the esophagus and biopsied multiple areas. The doctor promised a call with the biopsy results within the week, but that didn't happen. After several weeks of calling the office and then sitting anxiously by the phone, waiting for a call back, which is what we patients do, someone finally called and told the patient that all was well with the biopsies and that the doctor recommended repeating the EGD in 5 years. So the patient went on with life and was relieved, and other than being aggravated at the lack of communication, went on with her everyday world. Then a year later, the patient received a letter from the GI doctor's office reminding her that based on the results of last year's procedure, she needs to schedule another EGD to have the biopsy repeated. So the patient is quite confused and alarmed. She called the GI doctor's office and was told the nurse would call her. But again, the patient hung up the phone and started the cycle of waiting anxiously for a call back, making sure her phone's charged, keeping it close by at all times, checking it to make sure she didn't miss a call, and that it's still working. But the same scenario as before. No call, call again in a few days. Try not to express anger because then you'll be labeled and we'll never get a call. But again, no one called. After 3 weeks of this, the patient searched for and found an email address for the doctor and sent an email explaining about the verbal report and the letter and asking what you have to do to get a call back from anybody there. The doctor responded promptly to the email saying patients are not supposed to email the doctors. They are supposed to go through proper communication channels. However, the doctor did promise to try to figure out whether the verbal report from last year was correct or if the letter from this year was correct. So, more rhetorical questions. But the last question is one that I would like your answer to. What do you think? Should this patient feel confident that the latest communication is accurate, that all is well with those biopsies and she doesn't need to repeat this in a year? Who says that she should feel confident? Anybody think she shouldn't be confident that everything's okay? Anybody think anything at all? Okay. What would you do if that was you? Would you accept that and just go on with your merry, happy life? Okay. So our third case is a 57-year-old man. A few years ago, he developed a neck pain that rapidly worsened over a few weeks. He thought the unbalanced weight of carrying various weapons for over 3 decades in the military had caught up with him. Plus, he thought maybe the extra weight of the heavy bulletproof vests they recently added to his Air Force uniform could be causing the pain. But it didn't get better, and in fact, it got much worse, and his hands started to shake all the time, which made it difficult and probably unsafe for him to handle the required weapons at the air base. So in mid-November, he called for an appointment with his doctor. He's told there are no openings for 8 weeks, but he can see a PA in 3 weeks. So he took that appointment. We'll call this day 1, even though he has had the pain for a few weeks at this point. This is his first attempt at entering the healthcare system for this problem. So on day 21, he sees the PA who orders a neck x-ray, prescribes ibuprofen, and tells him to return for follow-up in 4 weeks. On the way out, he stops to schedule his follow-up appointment and finds out that he can schedule with his doctor in 5 weeks, so he schedules that instead. The x-ray was done at the local hospital the day of the first appointment, day 21, but after a week, no one had called the patient back with any results. So the patient called the office and was told someone would get back to him. On day 30, someone finally called and told the patient that the x-ray showed arthritis and said, we're going to get you set up with some PT. We'll call you back with that appointment. So it took 9 days to get x-ray results to the patient. How soon can you get x-ray results, and how soon do you get them to your patients? Or test results, any test results, I guess. Anybody? Pardon me? Few hours, thank you. Okay. My brother-in-law's a radiologist, and he tells me the x-ray results are typically available the same day, if not early the next day. So is it acceptable for a patient to have to wait 9 days to get any x-ray results? I don't know. As a patient, I don't feel that's acceptable. Oh, and about that physical therapy, no one called to tell the patient when or where to go for PT, and no one ever returned his calls asking about it. So Day 56, the patient returned for his follow-up appointment with his primary care physician, and he's in so much pain that he can be upright for maybe 20 or 30 seconds at a time. He takes his giant ibuprofen pills religiously, but he's not really getting any relief. He's been unable to work for 3 weeks at this point. And when he gets into the doctor's office, he has to lay on the floor for 45 minutes waiting for the doctor's office to call him back for his appointment just because he can't be upright. So at this appointment, his doctor reads the radiology report for the first time. Now remember, the x-ray was done on day 21 and this is day 56, so this report is now 35 days old. The report contains no mention of arthritis at all. But instead it says there is a distinct step-off at C2 and C3 of unknown etiology, and further imaging is essential. There's no explanation from the doctor as to why the patient was told it was arthritis, but the x-ray doesn't, or the report doesn't say that. So there's a lot of confusion. The doctor prescribes a strong muscle relaxer and then tells the patient to continue PT and return in 2 weeks. But the patient says, what the heck? Nobody ever bothered to let me know about physical therapy and nobody ever called me back to let me know when to go or where to go. So the doctor looks back through the medical record and then apologizes and says that PT was, a note was written for it, but it was never ordered. So he gets that done. And then the patient's wife says, hold on, the radiology report says more imaging is needed. Can't we get that done? And the doctor says, no, we haven't tried conservative measures long enough. We need to hold off and give this physical therapy a try and see what happens. So the patient and his wife leave. And on day 69, the patient returns to see the physician for his second or third appointment, but only the second appointment with the physician. He had had no improvement at all. In fact, he was worse, even after 3 physical therapy sessions. The doctor tries to console him and tell him that PT takes a while to help and tells him to continue with the physical therapy, increases his medication, and to return in 2 more weeks. But the patient and his wife stand in front of the door and refuse to leave until a scan is ordered, and that finally gets done. That takes place on day 73. And as soon as the images started coming across, everyone in the building practically jumped to attention because the picture showed that C3 was completely shattered by a 5-centimeter mass that was also displacing the spinal cord. The radiologist comes in to tell the patient and his wife about the mass and informs them the patient's neck is critically unstable. The radiologist and the patient's physician confer on the phone and agree the patient must be admitted. So he is very carefully transported from the MRI suite down the hall to the ED and told that he's going to be admitted to stabilize his C-spine and for comprehensive scanning and testing. After a cursory neurological exam conducted by a dismissive ER physician, the patient spent 6 hours laying on a stretcher in the hall in the ED with no consults, no treatment, no pain relief, and no admission orders. And finally, a nurse comes in and tells him, you know what, it's Friday night now, you know, there's really nothing that's going to happen over the weekend, so you'll be better off at home. And they send him home with this white thing to Velcro around his neck and instructions to see a neurosurgeon the next week. And he's told, you know, you really need to be sure not to stumble or bump your head, as that could be fatal or it would have serious, dire consequences. So day 77, he sees the neurosurgeon who orders a CT-guided needle biopsy, which is done the next day. And he waits after a week and hasn't had any results from the neurosurgeon's office. So he calls and they say they don't have anything yet. So they hang up and he waits. And finally on day 92, the nurse calls and says the results show sarcoma, non-metastatic, and that the mass in the neck is considered to be the primary tumor. The nurse said she didn't know what the next steps in the plan were, so somebody would have to call back about that. On day 93, the patient received a copy of the official written biopsy report, and it says this: metastatic high-grade sarcomatoid carcinoma. So totally different than what they were told on the phone, when that changed everything, of course. The biopsy report suggested that the primary site could be anywhere in the body and said that further imaging needed to be done to try to identify the primary source so treatment options could be determined. When the neurosurgeon finally called back, he said that he had no explanation for the extreme differences in the verbal report and the written report. And he tells the patient that there's nothing he can do for him, that his situation is not operable. But he's referring him for another opinion with another surgeon, and that they've scheduled that appointment for him for 3 weeks later. 3 weeks. It's already day 93, and somehow they think it's okay to wait 21 more days. So the patient's wife goes a little bit crazy and gets the appointment moved up to just 8 days later. On day 101, the patient sees the second surgeon, who concurs. He says he can't do anything for the patient, but he suggests that maybe a gamma knife could hold some hope. He promises that someone in his office will call with that consult set up, but as of this very minute today, that's never happened. So here the patient is at day 101, 28 days after the mass was found, and his neck was determined to be critically unstable. A biopsy has been done, but no other tests or scans or anything has been done to try to find the primary location of what they're saying is a very strange, very aggressive tumor. 2 surgeons have said, "I can't help you," and sent the patient on his way. So unable to get anyone to call them back, the patient's wife sent an email to the patient's primary care doctor pleading for him to order the scans and tests and for the patient to be sent to an oncologist. She also ended up having to contact the radiologist who found the tumor initially, and he helped the patient by paging the primary care doctor on the patient's behalf and getting things moving. Those very essential scans were finally completed over the next 10 days. So on day 113, the patient gets to see the oncologist finally. He reviewed the scans with the patient and his wife and children, and he tells this patient that his situation is actually very grim and recommends making sure his affairs are in order. A second opinion 2 weeks later concurs, and the patient and his wife were actually very shocked to be able to get into a major cancer center 100 miles away within just 2 weeks, when it took 4 months to get anything done here. And not just 4 months, but multiple instances of misinformation and countless unreturned phone calls. The patient is clearly unable to work and hasn't been able to since mid-December, but he has several months' worth of sick and vacation time that he would prefer to use instead of going on disability benefits, because he desperately needs to keep his insurance, his health insurance, in force without having to pay for COBRA on the drastically reduced benefits that disability brings. In order to do this, his employer requires that a form be signed by the oncologist saying that his health situation will prevent him from working for at least 6 months. The patient's wife hand-delivered the form and a pre-addressed, pre-stamped envelope to the oncologist's office, where they promised to get it signed and mailed back to the patient's employer that same day. But 6 weeks later, the patient received a termination notice from the airbase because he had failed to return to work, and the required form, which would have excused him, was never submitted. The form was, in fact, still sitting on the desk of one of the oncologist's employees. And the very rare, very weird, very aggressive cancer took this patient's life not long after he received that termination notice. So I'd like to tell you that situations like this are extreme, rare examples. But in talking with people around the country, it seems to be somewhat typical. And if you just do a simple Google that says, "my doctor won't call me back," you'll be swamped with all the results that come up. So Ms. Rain from the Robert Wood Johnson Foundation says that patients need to be able to navigate the healthcare system, which raises the question, how in the world does anybody do that? These patients all tried their hardest and failed. And Dr. Grumman has this to say about being drop-kicked into a foreign country and being a tourist. This is absolutely true. Although being a tourist can imply a pleasant experience in the healthcare system that is 99% of the time not the case. So how does a patient navigate the healthcare system? As patients, we think that our doctors and the staff in their offices are watching out for us, but as these three cases illustrate, that simply isn't the case. So do you have to have connections? Does that help you in some way? Well, the last patient had a ton of connections. His sister, his sister-in-law, his cousin, his brother-in-law is a radiologist, tons of advice and tons of insider help. And his wife works at the medical school, and I'm his wife. And no matter what we did, we could not navigate the healthcare system, and we could not help him get what he needed. The cases I've told you about today happened across multiple practices here in Springfield, and in some cases outside of Springfield. I have to believe that some practices are exemplary and excellent at implementing systems that patients can navigate, but clearly there are many that are not. And just to clarify, there were no residents, medical students, or anything involved in any of these cases. They were all long-time, highly experienced, highly recommended practitioners. And I tell everyone every day that if a resident had been involved in at least my husband's case, I believe that they would have stayed on top of it and these things wouldn't have happened. So back to the question at the beginning, again, a rhetorical question, but my answer would be that there absolutely are improvements that can be made on the front end of the healthcare system. And making those improvements has to be a very high priority. So I want you to think about these questions in your current practice, future practice, whatever. How are you going to make sure that your patients fare well in whatever system you're practicing in? Do you know the answers for these questions for your current clinical areas? Dr. Sanfi did a great job talking about, the areas in the hospital for communication breakdowns, but the people in the last two cases were never hospitalized. So there was no checklist, no handoff, no medical error form anywhere to fill out that would have maybe prevented these things from happening. And I want to end with a little story here too. How many people, does anyone in here not have a cell phone? So everybody has a cell phone. Okay, so you've all dealt with the cell phone providers, and I know they're frustrating and aggravating and they're time consuming, but I just want to go through this with you a little bit. After my husband died, there were lots and lots of things to deal with, as you can imagine. One of them was canceling his cell phone service, and I dreaded it. I just dreaded having to make that call and do that. I put it off as long as possible, not because I dreaded it so much, but because his friends and family from all over the world and my children still called his cell phone regularly just to hear him say, "Leave me a message." And they would pour their hearts out in his voicemail. But the phone had to go. The money, I couldn't afford it, so the phone had to go. So when I called the cell phone service provider, they expressed their sympathy. They canceled the service for his phone. They reviewed the services I was paying for to see if they could make the bill cheaper. And it took maybe a half hour, during which time they were very accommodating and very helpful. And I was so struck by that. I didn't have to make an appointment and sit anxiously by my phone and wait for weeks or months for someone to call me back. They just did it. They acted like helping me with that stupid cell phone was a life or death situation. Only it wasn't. What you guys do is life and death. But patients wait every single day for doctors and their offices to get back to them. I understand perfectly well that medicine is much more complex than a cell phone system. But I also feel very strongly that our current healthcare system, as far as communication goes, is seriously, actually fatally flawed. So to take from Dr. Sanfi's presentation, what questions do you have for Dr. Sanfi or I? Any comments, questions?